Hello, I'm Dr. J.C. Smith again. This time I'm here with my Southpaw gym manager, Josh, who I send patients to put on a spinal rehabilitation program. But he himself has had serious spinal problems, being a big athletic guy like he is. Right now we're working on his L5 lumbar disc, that is, because he's been having pains down in his leg. This was diagnosed years ago by an MD who, of course, wanted to do surgery, but Josh decided to come this route instead. But let me explain what's happening here. First of all, the DRX pulls not on a straight line like the old-fashioned traction tables, but it pulls incrementally from 0 up to 50 and then down again. And it goes on these cycles. And every time they come in, we increase the pull. Eventually, it will pull at 150 pounds for up to 30 to 45 minutes, depending upon the case. And when it pulls and tractions apart the disc and joints, it infuses it with moisture, water from your body to rehydrate the disc. Research has shown you could have the prettiest, straightest, strongest spine in the world, but if you're dehydrated, all the disc will eventually degenerate. It's quite amazing. So aside from getting adjustments and exercise and all that, you need to be drinking a lot more water than most people do. But the way it works, there's different levels, of course, between L1, 2, 3, and 4, and 5. Right now, as I said, we're pulling at L5, which is the lowest. But in other patients, we may raise this depending upon which motor unit, which disc is actually involved. And we do this in 24 sessions over a 4-month period. 3 or 4 depends on the case. And every case is slightly different. Aside from distracting, decompressing the spine as we're doing here, we may also adjust the sacroiliac joints because they get involved quite often. Or in Josh's case, we're also doing the mid, back, and neck because most people don't just have one bad spot in their spine. Through their lifetime, they've had numerous accidents. One study said that 3/5 of adult problems actually begin in youth. The kids fall off bicycles and roller skates and play football, and cheerleading is the second most dangerous sport in high school now. Gymnastics is a real killer for young girls. And then you don't just like say have one. How many times have you fallen off a bicycle? Quite often. Josh, what was your first injury?
My first injury was a football injury.
Football in high school?
Yeah.
What other ones have you had?
Well, at work, I injured myself at work.
At work, yeah.
Yeah, repetitive bending over and picking up.
Yeah, that'll do it.
Objects. Yeah.
Actually, back pain is the #1 workman's comp injury. It's also #1 in the military. Johns Hopkins University did a study on this. They found that back pain superseded bullets and bombs in terms of disabling soldiers. Unfortunately, although TRICARE does cover chiropractic, at Robins Air Force Base they decided not to do it. So they're just putting patients at risk by sending them into the medical model, which is opioid drugs, shots, and surgery. Doesn't work for 90% of the cases, but that's what they're doing. Have you had any other more recent injuries?
Recently, 3 years ago, I had an injury on the job, and I slipped my disc, and that was the worst one
Is that right?
I've had. Yeah, I had a slipped disc. So
Bad lifting.
Unbearable pain.
Bad lifting, prolonged sitting. It doesn't take a lot. What they found is there's a triggering effect, because most people, long before they have their back attack, they were just an accident waiting to happen. They have old misalignments from childhood injuries, sports injuries, of course, auto accidents, but their body will try to heal itself. And a strong guy like you, your muscles are enough to hold it in place. But then you can just sneeze or cough or prolong sit or just get up the wrong way, and boom, the joints just buckle. And then everything happens. The disc swells, the nerve gets pinched, you have the sciatica or whatever. So again, to stabilize this isn't just getting an adjustment or just getting decompressed. You got to put it all together. That's why we send patients to Josh's Southpaw Fitness on the north side of Warner Robins, and there he'll develop a personal program to rehabilitate your musculature and in many cases lose weight, because most people are 30, 40, 50 pounds overweight. Imagine, I tell patients, having a 50-pound bag of dog food on your shoulders and walking around with that all day long. Well, that's what's happening to your spine. And if you can get that off, you're going to feel so much better. Because again, back pain is a compression problem. Yeah, you get the mechanics involved, lifting, bending, twisting, but it's a biomechanical compression problem that causes a buckling effect, where the joints, like my finger, just buckle. It doesn't take, like a bad accident. You can just sneeze and throw your back out. That's like Bob Hope once said, you know you're getting old when your back goes out more often than you do. That's funny, huh? Do you remember who Bob Hope was?
Yeah.
Okay. Most people under 40 probably don't. But nonetheless, it's an involved process, and we get great success. I love getting people here that failed back surgery, because 50% or more of those fail. Unfortunately, a lot of people get talked into having a second, third, fourth, and fifth surgery. I saw a research paper that said by the fourth surgery, your likelihood of success is 5%. That's a lot of money you've wasted. Then what happens? People come to see us, they have all these screws in their back, they're in constant pain, and a surgery is called a controlled injury, so you have all the scar tissue and damage. And when they do surgery, this is one thing I've learned, people mistakenly think they realign them perfectly. They don't. Like, if you break your arm, they set it straight, they cast it straight, it heals straight. Unless it gets infected, there's no controversy. But not with back injuries. They just fuse you as they find you. I have people come in here more misaligned after the surgery than they were before. And then every time you do it, it gets worse and worse and weaker. So you can't stand as long, you can't sit as long, you certainly can't move. And then as you gracefully age and muscles get weaker again, and you wonder why you throw your back out just because you sneeze. So rehabilitating a back is not an easy task. I liken it to a football player ripping a knee. It's a very involved process, and again, for those of us who've had knee surgery, myself included, they don't go away entirely. You've got to manage that every day, like I do. Same with your back. We put people on programs at home or at Josh's gym. That's how you have to manage it for the rest of your life. That's why I tell people managing your spine is like dental care. You don't just go to the dentist when you have a toothache. No, you're taught from the time you have a tooth to brush and floss, right? And then just because the tooth may stop aching doesn't mean you stop brushing your teeth. Unfortunately, other than dental care, people have not learned that an ounce of prevention is worth a pound of cure. They just want to come in here like telling people, can't you just pop me once? Can't you crack me? Oh, it makes me cringe when they say that, because they're clueless. They have no idea what it really takes. They have no idea how serious their back injury is, because when you start damaging the spine, aside from paralysis and numbness and tingling business, those same nerves go into organs. How do you think they're going to behave? A lot of hypertension, arrhythmias, spastic colons, these can be in part due to nerve pressure from your spine going inward to your organs. That's been well shown. People don't know that, but they feel those effects after we adjust them, because what brings most people in, of course, is just back pain. But when the back pain subsides, then these other things start happening. I had a lady who had neck surgery. A guy in Macon, no better, didn't stop her migraines, didn't stop her tingling down her arms, which he promised, and she couldn't sleep. After one adjustment, she slept all night without a migraine headache. She came in the next day looking 10 years younger than she did the day before. But that's how important the spine is to your overall health, not just for pain control. So there's a lot to it, and we put people on a good program, and a lot of people ask about the cost of it, and I think we should talk about that. A back surgery is going to, according to the Mayo Clinic, cost $77,000. Around here, I had a patient who had his whole neck fused by a knife-happy surgeon over in Centerville, $250,000, and he was no better than before. Actually, he was worse. But for this program, it costs the same as one tooth implant. It costs less than your teenager's braces on their teeth. That's how inexpensive it is. And if we put them on a program, because insurance will not cover this. They will not cover non-surgical spinal decompression, but they'll be happy to pay $100,000 for surgical decompression that has over a 50% failure rate. It's crazy, it's upside down, and doesn't make sense. But nonetheless, this is an affordable program that most people can afford. And when I find people who come in here who just want the quick fix or they don't understand the value, we just tell them, go to other places. There's plenty of chiropractors, physical therapists, or drug management pain clinics. They'll be glad to ply you with all their stuff real cheap. But I tell you, it doesn't work, and it doesn't work in the long run either. I know. I've been doing this for 40 years, and I know what works, and I know what doesn't work. And I know people want the quick fixes. There's no quick fix to good health. As I teach patients, your habits catch up to you. Whether they're good habits or bad habits, eventually they will catch up to you. So my question is, do you have good habits about spinal care, about nutrition, exercise? I bet you 90% don't. I've seen it in here, 40 years, I have experience. So if you're a patient who wants to get well and stay that way, you want to lose weight, trim up, tone up, come see me. Come visit Josh's clinic up on the north side of town, Southpaw Gym, and we will teach you how to be well. Otherwise, come by the clinic. We're going to talk to you more about your case specifically. Bring your x-rays, MRIs, anything you have. The more you bring, the better we can discuss your case. Otherwise, see you then.